Hello everyone. As we enter 2025, I would like to give a very important message to everyone with diabetes. I'm seeing that increasingly people think it's not necessary to go to a diabetologist or to a diabetic center and have a regular diabetes checkup done. Either people don't go at all, saying that I am okay, therefore I don't need to go for a checkup. Secondly, even if they think of doing some checkup, they'll go to some nearby clinic, get one or two tests done, whatever they think is important, which may not be the most important test to do at all. And then they'll keep it. They don't even consult a doctor. They keep it and they think that's fine. I want to tell you a true story which happened recently, which is why I'm making this video today. There was an elderly lady who I had not seen for many years. And recently she did a checkup in some lab and the blood sugars came quite low. Her fasting blood sugar was around 60 and the postprandial blood sugar was around 90. And the HbA1c was also almost in the normal limits. If I had seen those results, I would have definitely de-escalated her therapy and prevented a hypoglycemia from coming. But she saw these results. She went to some other lab, got these tests done, and then didn't consult anybody. And a few days later, luckily for her, when she was sleeping with her 9-year-old grandson, the grandson saw that his grandmother was unconscious. Suddenly he got up in the night and found that her eyes were staring and her tongue had come out, and he got scared. And he went and called his grandfather, this lady's husband, and then they rushed her to a hospital and they found that she was in a hypoglycemia coma and she was revived. Luckily, she was revived without any brain damage. If this boy had not got up at 2:30 a.m. and seen this, she would have been in a coma for several hours, and it's possible that brain damage also could have occurred. When I saw this, of course, after that, they did come to consult me, and I said, why didn't you, when you saw these sugar values, why didn't you at least call me or, ask me? And she said, I thought it's normal. Now, this is the problem because I don't blame anyone, but see, a specialist will be able to use the experience that they have to foretell what can happen and to take precautions. As they say, a stitch in time saves 9. So if her medicines had been reduced, probably she would not have gone into that low sugar coma at all. Now, the reason for this is people say, I'm okay, I feel okay, so why should I even go for a checkup? Many of my friends whom I see every day, either when I'm walking or in some other social functions and so on, they would not have come back for many years. And when I ask them, they say, I'm doing fine, so why should I come? They think when we ask them to come, we are calling them for commercial reasons, just to do some tests or to get consultation. It is not at all that. It is because early changes should be detected in the body. And if you don't come for a checkup, we lose that opportunity of either finding out whether you have a high sugar or a low sugar or early changes in the kidney or the liver. Let me also tell you that every year, among the patients who come to our centers for routine checkup, we pick up 10 to 12 cases of early cancer. They have not come for that at all. They just come for routine checkup. But when you do an ultrasound, you do an X-ray or do some blood test or something, we'll pick up an early cancer. And those patients have been cured because we rush them off to a cancer specialist and they either have a surgery or they have treatment and they're completely cured. And years later, they thank us saying that if you had not come for the checkup, you would not have diagnosed it. Just imagine if they had not come for a checkup, 6 months later, the cancer would have completely spread, isn't it? So there are many things like this in medicine where if you're able to diagnose it early, we can give treatment. So the next time you think or one of your close relatives think or say, I'm okay, so why should I go for the checkup? Remember, you may not be okay, and there may be subtle changes occurring which need to be checked up. All we are saying is at least 2 or 3 times in a year, come and see the diabetologist, come and see us, show us the test, get some basic tests done, and who knows, it could be life changing, it could be even life saving for you. So, this is a very important message that I wanted to give in the beginning of 2025 so that none of you make the same mistake as this lady made. Thank you very much for listening.